There is a silent epidemic affecting more than half of all post-menopausal women. It's a condition that can cause chronic pain, destroy intimacy, and dramatically impact your quality of life. Yet, it remains one of the most underdiagnosed and undertreated issues in all of women's health, hidden behind a wall of silence and embarrassment. Today, we are breaking that silence. We are going to talk about the number one condition most women have after menopause, but never talk about: atrophic vaginitis, or what is more accurately called the genitourinary syndrome of menopause. And I will show you that it is not a life sentence. Let's start by demystifying the terminology. For years, this condition was known as atrophic vaginitis, a term that is both intimidating and incomplete. Atrophy implies a wasting away, and vaginitis suggests it's only an issue of the vagina. The modern, more accurate term is the genitourinary syndrome of menopause. This is a crucial distinction. Genitourinary acknowledges that this condition affects the entire system: the genitals, the vulva, clitoris, vagina, and the urinary system, the urethra, bladder. This explains why so many women experience a frustrating mix of both vaginal and urinary symptoms without ever realizing they stem from the same root cause. And that root cause is the dramatic and permanent decline of the hormone estrogen. To truly grasp the impact of GSM, we need to appreciate the profound role estrogen played in our bodies for decades. Think of estrogen as the master architect, gardener, and plumber of your entire pelvic region. As an architect, it instructed your cells to produce collagen and elastin, the proteins that gave the vaginal walls their thickness, their strength, and their characteristic elastic folds, or rugae. This structure allowed for comfortable stretching and accommodation. As a gardener, estrogen maintained a lush and healthy ecosystem. It ensured a rich blood supply to the tissues, bringing oxygen and vital nutrients. It also maintained a healthy, acidic vaginal pH around 3.8 to 4.5. This acidity was not an accident. It was the perfect environment for beneficial bacteria like lactobacillus to thrive, which in turn kept harmful infection-causing bacteria at bay. As a plumber, estrogen ensured the pipes were working. It maintained the health and integrity of the tissues in your bladder and urethra, helping to prevent leaks and infections. When menopause arrives, this master architect, gardener, and plumber essentially retires. The ovaries, which were the primary estrogen factories, shut down production. The pelvic tissues lose their primary source of nourishment and maintenance. This is not a disease you catch. It is a fundamental physiological shift. The vaginal walls become thinner, sometimes as much as 80%. They lose their elasticity and collagen. The blood supply diminishes. Natural lubrication, which was once abundant, is drastically reduced. The pH level rises, becoming more alkaline, making the environment more hospitable to infections. It is a slow, progressive change. It doesn't happen overnight. This is why many women don't connect the dots for years. They might notice a little dryness one year, a little irritation the next, and recurrent UTIs the year after that. They treat each symptom as a separate, isolated problem, never realizing they are all branches of the same tree, a tree whose roots are no longer being fed by estrogen. The most tragic part of this entire process is the silence. Women suffer thinking it's just them. They feel ashamed, believing their bodies have failed them. They feel disconnected from their partners and from their own sense of self. This silence is what we must break today. Understanding the why is the first step. You are not broken. Your body is undergoing a predictable, understandable change. And the good news is we have incredibly effective ways to manage it. But first, let's explore the full, surprising constellation of symptoms that GSM can cause.
We've established the why behind GSM. Now let's dive deep into the what. The symptoms of GSM are far-reaching and can be grouped into three main categories. As we go through these, you may find yourself having aha moments, connecting dots you never thought were related. Symptom Cluster 1, the vulvovaginal symptoms, the most obvious signs. This is what most people associate with the condition. Dryness? This isn't a temporary issue, it's a persistent, chronic feeling of dryness and lack of moisture. It can make daily activities like walking or sitting uncomfortable. Irritation, itching, and burning. The thinning tissues are incredibly fragile, like delicate silk instead of resilient cotton. They are easily irritated by clothing, soap, or even just daily movement, leading to a constant nagging sensation of itching or burning. Many women mistakenly believe they have a chronic yeast infection, using over-the-counter creams that provide no relief because the root cause isn't fungal, it's hormonal. Pain during intimacy, dyspareunia. This is often the most distressing symptom. The combination of dryness, lack of elasticity, and thinning tissues can make intercourse feel like rubbing sandpaper. It can range from mild discomfort to excruciating pain. This creates a powerful negative feedback loop in the brain. The brain learns to associate intimacy with pain, and as a protective mechanism, it shuts down desire, libido. This can create immense strain on relationships, leading to feelings of guilt, rejection, and profound emotional distance between partners. But it is crucial to understand that you are not alone, and you do not have to live this way. Effective, safe treatments are available. In our final part, we will explore the complete blueprint for finding relief. Symptom Cluster 2, the urinary symptoms, the great masquerader. This is the cluster that surprises most women and their doctors. They spend years treating what they think are bladder problems without ever realizing the connection to their hormones. Urinary urgency and frequency. Do you feel like you always have to go to the bathroom? Do you know the location of every public restroom in a 10-mile radius? This is a hallmark symptom. The tissues of the urethra and the base of the bladder are rich in estrogen receptors. As they thin, they become hypersensitive and irritable, sending "I have to go now" signals to your brain even when your bladder isn't full. Painful urination, dysuria. A burning or stinging sensation during urination. This is often immediately diagnosed as a urinary tract infection. But with GSM, you can have the symptom without any infection present simply because the urethral tissues are so thin and inflamed. Recurrent UTIs. This is a massive and debilitating problem for many post-menopausal women. The shift in vaginal pH from acidic to alkaline allows harmful bacteria like E. coli to flourish. The proximity of the urethra to the vagina means these bacteria can easily migrate and cause one bladder infection after another. Women are often prescribed endless cycles of antibiotics, which can disrupt their gut health without ever addressing the underlying hormonal environment that is making them so vulnerable in the first place. Stress incontinence. While not always caused by GSM alone, the weakening of pelvic floor tissues due to the loss of estrogen can contribute to leaking urine when you cough, sneeze, or laugh. Symptom Cluster 3, the physical and appearance-related signs. These are things you might notice visually. Physical changes. The external vulva can change in appearance. The labia may appear thinner and paler due to reduced blood flow. The vaginal opening may seem to narrow. These are normal, albeit sometimes distressing anatomical changes. The cumulative impact of this constellation of symptoms can be devastating. It can erode your self-confidence, disrupt your sleep, put a strain on your most intimate relationship, and make you feel a prisoner in your own body. But it is crucial to understand that you are not alone and you do not have to live this way. Effective, safe treatments are available. In our final part, we will explore the complete blueprint for finding relief.
We've identified the problem and its far-reaching symptoms. Now for the most empowering part, the solutions. The treatment for GSM is a layered approach, a spectrum of options that you and your doctor can explore together. Step 1, the foundation, lifestyle and non-hormonal options.
This is where every woman should begin, as these steps can provide significant relief for mild symptoms and support any other treatments. Stop using harsh soaps, bubble baths, or scented products in the genital area. These can strip the skin of its natural oils and worsen irritation. Warm water is all you need for cleansing. Vaginal moisturizers. I cannot stress this enough. These are different from lubricants. A vaginal moisturizer is a health product, like a facial moisturizer. It is used regularly every 2 to 3 days to rehydrate the tissues, improve their elasticity, and restore a healthier pH. Look for products that are specifically designed for this purpose, preferably with a hyaluronic acid base and free from hormones, parabens, glycerin, and perfumes. Consistent use can provide profound relief from daily dryness and irritation. High-quality lubricants. A lubricant is used during intimacy. It is non-negotiable if you are experiencing any discomfort. Its purpose is to reduce friction and prevent the painful micro-tears that can occur in atrophied tissues. There are water-based, silicone-based, and oil-based options. Silicone-based lubricants tend to last longer and are very slippery. Water-based are easier to clean up. The most important thing is to use it generously and communicate with your partner. There should be no shame in this. It is a tool for mutual pleasure and comfort. Pelvic floor physical therapy. For many women, especially those with pain, the pelvic floor muscles can become chronically tight and tense in the protective response. A specialized pelvic floor physical therapist can be a lifesaver. They can teach you exercises to both strengthen and relax these muscles, which can dramatically reduce pain and improve sexual function. Step 2, the gold standard treatment. Local estrogen therapy. For moderate to severe symptoms, this is the most effective treatment available because it addresses the root cause, the lack of estrogen. I want to be very clear. Local or vaginal estrogen is not the same as systemic HRT that comes in pills or patches. The amount of estrogen in local therapy is minuscule, and it acts directly on the pelvic tissues with almost no absorption into the bloodstream. For this reason, it is considered extremely safe for the majority of women, even many breast cancer survivors, in consultation with their oncologist. Forms of local estrogen. All by prescription. Vaginal creams like Estrace or Premarin. You use a small applicator to insert a small amount of cream into the vaginal area, typically at bedtime. You might do this nightly for 2 weeks, then reduce to twice a week for maintenance. Vaginal tablets or inserts like Vagifem or Imvexy. This is a tiny tablet or soft gel insert that you place in the vagina with a slim applicator. It's pre-dosed, so it's very clean and easy to use. The schedule is similar to creams. Vaginal rings like E-string. This is a soft, flexible silicone ring that you or your doctor places in the vagina. It stays in place for 90 days and continuously releases a very low, steady dose of estrogen directly to the tissues. Many women love this set it and forget it option. How long does it take to work? You may notice some improvement in a few weeks, but it can take up to 2 to 3 months to experience the full benefits, as the tissues need time to heal and rebuild. Patience is key. Step 3, advanced and systemic options. For women who also have other severe menopausal symptoms like debilitating hot flashes, systemic HRT, pills, patches, gels may be an option. This will treat the GSM symptoms as well as the others. Newer treatments like oral medications, ospemifene, or laser therapies are also available, but are typically considered second or third line options. The journey to relief begins with a single step, a conversation. Write down your symptoms. Use the term Genitourinary Syndrome of Menopause with your doctor. If they dismiss your concerns, find another doctor. You have the right to feel well. You have the right to a comfortable, joyful, and pain-free intimate life. Breaking the silence is the first and most powerful step. If this guide has helped you understand your body better and feel empowered to seek help, please subscribe to Dr. Maskola. Our entire mission is to provide trusted, compassionate, and science-backed information for women in this chapter of life. Click that subscribe button, share this video, and let's end the silence together.